Good afternoon. Welcome to day 257 at the EMA office where Chairman Kern and Sam Bierman is with us today. Sam, you have the numbers.
I do. We had a little bit better of a day today than we did yesterday, but are still nowhere near where we need to be. As of today, 150,496 St. Clair County residents have been tested, which is an increase of 2,016 from yesterday. We are at 13,858 positive test results, which is an increase of 226 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 11.2%. And we are at 136,638 negative test results. Unfortunately, we are announcing 2 additional deaths today. Both were males. One was in their 60s and one was in their 90s, both with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 11,327. For state totals, 10,104,537 have been tested, with 685,467 positive test results, which is an increase of 11,378 from yesterday. And for deaths, the state is reporting 11,832, which is an increase of 155 from yesterday. For hospitalization numbers in St. Clair County, currently we have 97 patients that are admitted due to COVID-related reasons, and 12 of them are on ventilators. Regionally, we have 244 patients that are admitted due to COVID-related reasons, and 29 of them are on ventilators. For our congregate living facilities that are currently or previously are in outbreak status, these are cumulative numbers and we will only announce any facilities that have had any changes. Aperion Care Center in Mascoutah has 8 cases and no deaths, and that is an increase of 1 case for that facility. Caseyville Nursing and Rehab has 87 cases and 2 deaths. That is an increase of 14 cases for that facility. Cedar Ridge of Lebanon has 108 cases and 16 deaths, and that is an increase of 5 cases for that facility. Integrity Healthcare of Belleville has 38 cases and no deaths, and that is an increase of 4 cases for that facility. And finally, St. Paul's Home in Belleville has 76 cases and 15 deaths, and that is an increase of 4 cases for that facility. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll move into the zip code report. At this time, these are the COVID positive changes in these particular St. Clair County zip codes. 62201 we go down to today to 359. 62203 up 2 people to 374. 62204 up 1 to 222. 62205 is down 1 to 358. 62206 up 2 to 675, 62207 up 2 to 365, 62208 up 6 to 794, 62220 up 10 to 981, 62221 up 23 today to 1286, 62223 up 9 to 865, 62225 up 1 to 70, 62226 up 19 to 1461, 62232 up 14 to 423, 62239 is up 9 to 202, 62240 is up 1 to 72, 62243 up 5 to 282, 62254 up 4 to 457, 62255 up 3 to 30, 62257 up 8 to 109, 62258 up 10 to 505, 62260 up 5 to 315, 62269 is another big day today, up 28 to 1,376. They're rapidly gaining on the number 1 zip code in the county, and 62269 is rising way too fast. 62282 up 1 228, and 62285 up 4. If we look at our numbers today, our county positivity was 11.2% today. Still, 226 new positives in the county is way too many, but we did have 2,016 tests, so that's where we get the 11.2% number. That brings our 7-day rolling average to 12.9%. Still way above where it was a little more than a month ago. The state has our regional positivity today down again, pegged at 14.1%. That's derived by Bond County at 22.2%, Clinton County at 16.4%, Madison County at 15.1%, Monroe County 6.7%, Randolph County 19.5%, St. Clair County at 10.3%, and Washington County at 31.4%. So remember tonight, is always a big night that people are used to going out and gathering as friends come into town from college, those kind of things. Bars always were hopping. We would really encourage everyone to stay close to home, keep with your family unit. Let's contain the spread. We'll be able to maybe have a little easier Christmas season if we don't have a big blow up here at Thanksgiving. With our numbers being so high right now, the chances of exponential growth are great. And so we want to make sure that if you stay home, if you wash your hands, if you wear your mask and you watch that social distance, we think we can get through this without a big spike. But as we heard earlier this week from both hospitals in St. Clair County, both hospital administrators, not all the hospitals, but Memorial and St. Elizabeth's represented, are very fearful about these numbers, and being able to handle much more of a spike in these numbers would be very difficult, given the fact that all our doctors, nurses, all those frontline workers, they have been taxed to the max, and they're tired, and they really are stressed out, and we really need to help them to keep the numbers out of the hospital.
Well, and Chairman, the numbers are sliding slowly but surely, and anytime they're going down, we'll take that. And for those of our Team St. Clair members that follow these, and believe me, there are some of our members out there that look at these numbers every day, and they post their own responses, and we appreciate that. So we're heading in the right direction, but we got to keep it that way. 2 more deaths in the county, as we've said all along. 1 is too many. 155 more in the state of Illinois. I mean, the state's up to 11,832 deaths alone, and that's terrible. And you talk about our first responders. I asked Sam, we got something that I want her to read. It's a little long, but I think it really hits home when we're talking about our first responders and our healthcare workers. So if you would, Sam, would you read that?
Absolutely. And I think it is the perfect time to play this, as we are asking people to make good decisions going into not only Thanksgiving, but the Christmas holiday season. When you make these good decisions, you're not only doing this for you, but you're doing this for frontline workers and those around you. So this was sent in by a nurse, and it says, "I will be one of the first nurses to admit that I was not scared of COVID for my own personal health. But what I am scared for is my mom or another family member who gets told they need to go to the hospital for a medical emergency, but we have no beds available. For loved ones who have to die alone because the visitor restriction policy is too strict due to COVID. Or someone not getting to say their goodbyes to their grandmother. For myself, as well as my coworkers, for not having staffing or resources to keep up with the number of patients and their needs. For the amount of stress and discouragement the healthcare world is facing right now. I get asked all the time if COVID is real, if the vaccine will work, and do these patients just crash because of underlying health issues, or is the news making all of this up? I'll admit at first I didn't believe the numbers or the news until we started working with COVID patients firsthand. And now we have no beds available for COVID or non-COVID patients. I don't know if anybody knows the answer to when this will end or if the vaccine will work, but what I can tell you is that I have watched young independent people on room air crash in the matter of minutes due to COVID. I have had to be a part of choosing which patient to send to the ICU first because we only have one bed available. Leaving people on my floor who need a higher level of care due to increased heart rate or oxygen needs for many hours, and my coworkers and myself are stressed and overwhelmed and afraid these patients are going to die or have a stroke due to no beds or staffing available. We have watched loved ones die with just the nurse and tech at the bedside, in masks and shields because visitors are not allowed. I have watched many patients go from a full code to a DNR because COVID has overtaken their bodies. I can tell you that us nurses, technicians, therapists, doctors, and everyone involved are all scared for what is to come after the holidays. Going through a pandemic like this and being on the front line, you find yourself so thankful for your coworkers and their hearts and their teamwork. I have always known that my coworkers are some of the best, but seeing everyone stand up and take on what is in front of them and what is here and what is to come is incredible. Thank you to all of our healthcare workers out there. It takes us all. Here's hoping to this pandemic ends soon. Please, if you are sick or have any symptoms at all, please stay home.
Well, I think that pretty well sums it up. And for Team St. Clair members out there, I asked Sam to share that with us because the person who sent that in is definitely, you can tell, touched their heart, and they wanted to share that. And I don't know how anybody, I don't even want to think about it. Somebody out there that can continue to sit there and say that it's a 99% survival rate, it's this, it's that. The thing is real, and we've been telling you that for 257 days. 2 more deaths in our county today. I don't know what it's going to take to make some of you understand that. For Team St. Clair, please continue to share the word. Don't let the naysayers disrupt you. I had a couple of messages last night from some of the team members that said they're just wore out, and we are too. As we said before, we may all be wore out, but the virus isn't. It's still here, and it's going to be here. We will be here tomorrow. We want everybody to try to have a happy and safe virtual Thanksgiving because, that's what we have to do. But we will be here tomorrow afternoon for day 258. We'll be back with Cindy in just a few moments to translate this into our Spanish communities. Everybody have a good night.
Meet Jeff. Jeff is returning home to have Thanksgiving with his family. Unbeknownst to him or his family, Jeff is an asymptomatic carrier of COVID-19, meaning he has shown no signs that he has this deadly virus. Jeff spends most of his Thanksgiving day at home with his parents and sister, enjoying a Thanksgiving feast. After dinner, Jeff and his sister decide to go to their grandparents' house for dessert. Several other family members have come over to enjoy Grandma's famous pie. On Saturday, Jeff starts displaying symptoms of COVID-19, including a fever. He goes to get tested and finds out that he is positive and a carrier. Meanwhile, Jeff's grandfather starts also feeling ill. Eventually, he would have to be transported to the hospital because he's unable to breathe properly. Because of his close proximity to all of his family members 48 hours prior to the onset of symptoms, they must all now quarantine for 14 days. Jeff also now has to isolate himself for 10 days, and Grandpa remains in the hospital. We would like to remind you that COVID-19 is still infecting our community at an astronomical rate and taking lives each and every day. It's so very important to keep our gatherings small and only celebrate with those within our own family units. While these decisions can be difficult, if we work together, we can stop the spread of COVID-19. Wear your mask, wash your hands, and watch your distance.